We had a number of cases. The minister did formally announce the first few cases, but he felt that he needs to do a formal public announcement as far as the current situation is, and also outline the plans or the efforts by the government working in collaboration with a number of stakeholders who are represented here today. Without wasting any time, we have got members of the panel. We are joined by Minister of Health, Dr. Joe Phaahla. I'm also going to allow my colleague, who is the Deputy Director General for Primary Healthcare, Ms. Jeanette Hunter, to officially introduce other members of the panel. You may not be familiar with the faces, but she will take you through.
Thank you, Foster. Let me also join Foster by thanking you all for your time, and thank you for coming out to listen what Minister has to say and for us to answer your questions. So supporting the Minister, we've got the head of the World Health Organization in our country, Dr. Fabian Ndenzako, over there. And then if you can just wave Dr. Ndenzako to the colleagues from the media. And then from the National Institute for Communicable Diseases, known better by all of us as NICD, we've got Dr. Jacqueline Weyers, and she will also be attending to some questions from you. The panel is supported by my colleagues from the National Department of Health. We've got the Head of Health Programs, Mr. Rampilani Morawani here. We've also got colleagues from the Communicable Disease Directorate in the National Department of Health, as well as Environmental Affairs, and then we also have technical experts from the WHO sitting in the audience with you. Thank you, Foster. Foster is giving me the honor to ask the Minister to come and address us on this matter.
Thank you very much, Ms. Hunter, and also to Mr. Foster Mohale. Let me also welcome the presence here of our WHO country head, Dr. Fabian Ndenzako, and also Dr. Jackie Meyer from the NICD, and all other colleagues who are here present. As Foster has already indicated, we just needed to update the media and the public in terms of developments with the Mpox. Now, a global outbreak of Mpox was announced by the WHO in 2022. You may remember that just at the end of the COVID pandemic, then there was the Monkeypox, now called Mpox outbreak in various parts of the world. Mpox is a notifiable medical condition which the healthcare workers are required to report all the suspected and especially the confirmed cases. Notifiable medical conditions refer to diseases that are of public health importance because they pose significant public health risks that can result in disease outbreaks or disease epidemics with high case fatality rates, both nationally and also internationally. The previous outbreak of Mpox in South Africa was in the same year that the WHO announced the international outbreak in 2022. During that period, we had 5 cases confirmed in the Western Cape, in KwaZulu-Natal, in Limpopo and Gauteng. But in the course of 2023, we did not report any confirmed cases of this disease of Mpox. According to the WHO multi-country outbreaks of Mpox, which was published in May this year, cumulatively from January 2022 through to end of April this year, a total of just over 97,000 laboratory confirmed cases of Mpox, that is worldwide, and in this 186 were fatalities from 117 countries in all the 6 regions of the WHO. A total of 528 new cases were confirmed in the course of April this year. But this, we must indicate that we're actually representing a decline. Is the microphone not on? This was actually indicating a decline in cases if we're comparing with previous months. Just as I said, this was in April. If you look at previous months, it was showing that there was a decline. The most affected WHO regions in order of the number of laboratory confirmed cases were the Americas, the region of the Americas, the Africa region, the European region, the Southeast Asia region, and the Western Pacific region. In the African region, the DRC reported the most, with just over 99% of the confirmed cases of the continent being in the DRC in the reporting month. Just as before we came here, we were just discussing with WHO and the NICD experts, and they were indicating to me that actually in the DRC, Mpox is considered to be endemic. And also, as we discuss further, that the variant in the DRC it's different from the variant which is multi-country transmitted. The disease is caused by a monkeypox virus, which is an orthopox virus that transmits from person to person through close contact and from unknown animal reservoirs in East, Central and West Africa, including DRC as one of those countries. Multi-country Mpox outbreak is characterized by sustained human-to-human transmission via direct skin-to-skin and also sexual contact. People living with HIV are disproportionately affected due to immune suppression. South Africa is amongst the countries currently experiencing the current outbreak. This infection, which, as I've already said, spreads from one person to another, although also being transmitted from animals. In the current outbreak, we have recorded 5 laboratory confirmed cases, and regrettably, one of those have passed away. 2 of these cases were confirmed in Gauteng and 3 in KwaZulu-Natal. The death that occurred is amongst the 2 cases in Gauteng. This patient passed away late on Monday this week, Monday the 10th of June in Tembisa Hospital. All cases and all the patients are males aged between 30 and 39 years without any travel history to other countries which are experiencing outbreaks. So this then says to us that we do have local transmission. It's not imported cases. All 5 cases were classified as severe cases as per WHO definition, and they were requiring hospitalization. The cases have comorbidities and have been identified also as part of what we regard as key populations, which include men who have sex with men. Thus, the department is reaching out to organizations who are working within the South African National AIDS Council, organizations focusing on the HIV programs, and also working with key populations, in addition to other stakeholders, to implement targeted communication and to intensify awareness about the outbreak and the fact that we can confirm that there is local transmission. One of the patients has been discharged. One has also been discharged home, but for further isolation, being followed up. The 2 other patients are still admitted in hospital. As we said, there were 5 cases. One has passed away, and the other 4, 2 are still in hospital. One is being followed up at home, and the other one is discharged completely. Sequencing analysis of 3 of the cases revealed the category which is called Mpox clade 2B. And that this is important, as I indicated, the experts were indicating to me that the variant which is dominant in the DRC is not the clade 2B. They will explain how it differs. It's clade 1, so that it's a different one. But the clade 2B is the one which is dominant in the multi-country Mpox outbreak, which began in 2022. So the ones in our country are consistent with the multi-country outbreaks in various parts of the world, and different from the strain or the variant in the DRC. So, as I've indicated, we've had 5 cases thus far. The first one on the 8th of May in Sidibeng district in Gauteng, a 35-year-old male. I've said all of them are males. The second case was on the 21st of May in eThekwini, 39-year-old male. 31st of May, the third case, also in eThekwini, 30 years old. And on the 3rd of June in eThekwini, also a 33-year-old male. And lastly, it's on the 7th of June, the male patient who was admitted to Tembisa Hospital, who unfortunately is the one who demised. A further history of the patient who demised indicates that he's originally also from KZN, but he's not been in KZN for some time. The medical history indicates that he left KZN in December, although he's got family there, but he left KZN in December and he had not been home since that time. So it doesn't look like there's a link with the KZN cases over about 5 months. Now, all National Health Laboratory Service laboratories have been sensitized to the ongoing outbreak and are referring samples for testing with the NICD. The private sector laboratories are also testing for Mpox, while NICD serves as the reference laboratory. Since the beginning of 2024, the NICD has received 12 Mpox test requests, with 3 testing positive. The other 2 cases were diagnosed by private laboratories. Guidelines have been updated and shared widely across networks of health workers using various platforms. The National Institute of Communicable Disease, the NICD, continues with epidemiological and surveillance activities to identify cases for investigation, to estimate the magnitude of the disease through systematic data collection and analysis. A total of 38 contacts were identified in KwaZulu-Natal by the outbreak response teams. The contacts include household contacts, about 16 of those, hospital contacts, partners, sexual partners, friends. One of the cases from the KZN patients did confirm that he had sexual contact with multiple partners, and that those partners include both males and females. So as much as this is dominantly, as you can see from the patients, that it's mainly men and also associated with men who have sex with men, but we're also conscious of the fact that women are also affected. And as you can also get from the case history of one of the patients. Regarding the case notified on the 8th of May in Gauteng, 7 contacts have been followed for 21 days, and none of them showed any signs of symptoms of Mpox. Regarding the case notified on 7 June, that's the last one who demised, the list of identified contacts was being developed, and they will be monitored for 21 days. So I must indicate, and as we communicate with the public, it's also to encourage that people who, for one reason or another, may know that as much as we cannot disclose actual identities of the patients in terms of confidentiality, but we encourage people who may know that in one way or another they have an association with somebody with the disease, to, if they show any symptoms of skin lesions, rashes, to approach the nearest health facility so that they can be tested. Provinces have been notifying all the cases that meet the case definition of a suspected Mpox case in the notifiable medical condition system. Meanwhile, the outbreak response team, comprising of experts from the health department, from national and provinces, and the NICD, and also WHO and other stakeholders in the health sector, have embarked on contact tracing and case finding in affected provinces. We can just indicate that in our discussion, it did actually come out that it is not easy to do a full tracing. Sometimes it's difficult to exhaust all the contacts, unlike in terms of other ailments like TB, like when we had COVID as well. Because of the stigma which is still associated with the fact that it is a disease which is associated with a certain sexual orientation, it makes it a little bit difficult to always get to the bottom and trace all the contacts. In terms of treatment interventions, at the current moment, in South Africa, we don't have a registered treatment for Mpox. However, the World Health Organization recommends the use of an antiviral treatment called tecovirimet. This is an antiviral agent which has shown to be useful in the treatment of Mpox, and it's mainly used when patients are severe, and also, as we have indicated, that it gets more severe with patients who are immune compromised, and also in all our 5 cases, the clinical indication is that all of them were immune compromised. So, and especially when the CD4 count is less than 350, then this antiviral agent then is used. Although it's not registered with our South African Health Product Regulatory Authority, SAPRA, the Department of Health has obtained from SAPRA an emergency use approval, which is called a Section 21 approval for compassionate use for patients with severe disease. So that has been obtained. So 3 of the cases have actually been treated with this tecovirimet as advocated by and guided by the NICD. It was obtained through this Section 1 approval, emergency compassionate approval by SAPRA, and also we got it donated through WHO. So SAPRA has currently approved for our department to can actually obtain bigger doses of this antiviral in case there are more cases, and the WHO will assist us in terms of getting access to the treatment, so that if there is further outbreaks with with severity, then this can be utilized. We are also looking at obtaining vaccines, Mpox vaccine. Options are being considered as to from our department working with SAPRA and WHO. We are also accessing the vaccines, small doses of the vaccine, and we then still working on who will be the priority target in terms of the vaccination. So we're trying to source that from WHO member countries who have stockpiles that exceed their needs, but we're also approaching Gavi, the global organization which also distributes vaccines to access these vaccines. So these vaccines, once obtained, will be distributed to all provinces so that those at high risk can then be vaccinated. So our National Advisory Group for Immunization technical group has been established, which will then guide how the vaccine will be used. So this will be used for high-risk groups, including but not limited to sex workers, those who have identified as high risk, also, as I've said, men who have sex with men, health workers, and also laboratory workers will be prioritized in terms of vaccination. From a communication point of view, our department has been working with partner organizations to intensify targeted and public awareness using various channels of communication to make sure that the public is sensitized about the risk of this Mpox, so that people can know when they are at risk and take action in terms of approaching health facilities. As part of additional efforts to increase opportunity for engagement, a clinical management webinar has been convened and was attended by 500 healthcare workers and public health professionals from across the country. Now, the most important intervention at present remains communication and community engagement, which is being implemented, including addressing the high-risk populations, as I've indicated, sex workers, also men who have sex with men. But we have to deal with this with a lot of sensitivity so that we don't exacerbate the stigma, which can also cause problems. We are also reaching out to organizations who are, as I've said, within civil society organizations in SANAC, and also those organizations which are also focusing on the key risk population. In as far as travel, there is no recommended travel alert, as we have said that this is an infection which spreads through very close contacts. It's not like influenza and the aerosol, those which spread through the air. It's spread through very close contact. So there is definitely no recommendation for any travel restrictions. We can indeed prevent further spread if anybody who has suspected symptoms must present themselves. And again, just to emphasize the fact that its presentation is in the form of skin lesions, eruptions on the skin, and very painful lesions on the skin. Those who have had chickenpox will know that chickenpox also presents as a skin eruption. So all this pox, chickenpox, Mpox, so they develop with. So I think one can safely say that, especially for adults, anybody who develops those kind of eruptions on the skin, painful, even if you may think it might be chickenpox. So even for young people, the advice would be that they should seek medical attention so that it could be tested. As we have seen that, especially with those who are immune compromised, we have already had one fatality. And this patient was quite sick, and we were informed from the hospital that even though the antiviral agent which I've mentioned was available, because of the severity of the source, the patient could not even swallow the treatment, and unfortunately demised within a few days. So our endeavor is really to prevent any further deaths and to call upon our population that first of all, if you have had any contacts, make sure that you can be monitored, and if in the event that you develop any kind of skin lesions, go to the nearest health facility so that they can be tested and make sure that it is definitely not this Mpox. So we'll end it there, ladies and gentlemen. Thank you very much.
Thank you, Minister, for that update. We are now going to open the floor for questions both here and online. Let's first check if we've got questions online. Not yet. Okay. Let's first deal with the questions in house. Let's see. I see 1, 2, 3. You'll just introduce yourself and your media house for the sake of everybody to know you. We'll start here, then, yeah, in that order, please.
It's Heidi Junkos from ENCA. Minister, I just want to ask if you or whoever could just further elaborate around Mpox, because there's obviously a stigma attached to it, and you don't want a situation where people might be experiencing certain symptoms and then they're too scared because of the stigma that's attached around it. That's the first question. The second question is around the contact tracing. Are you 100% certain that you have been able to contact trace all those that have been in contact with for now? Okay, well, actually all 5 cases, because you obviously don't want a situation where people have not been notified around this. Just those 2 questions for now. Thank you.
Thank you. User Maverick.
Thank you. Hi, it's Corinda from Newsroom Africa. I've got 3 questions, if you can please indulge me. In terms of the local cases, you mentioned, Minister, there was no travel history for the patients. I'm sorry, in terms of the local cases, you mentioned there's no travel history for the patient. So just in layman's terms, how would the patient then contract the virus here? What are the factors to contract the virus? The second is, there are 5 cases. It is a notifiable disease, but in layman's terms, why do we consider it an outbreak? Just if you can explain your concern to the public. And lastly, for the NICD, this sort of briefing reminds us about the days of COVID-19, the pandemic. With the ongoing health issues, the flu that's going around, are there any concerns that we could potentially see another such outbreak of a disease that would cause something that we saw during COVID-19? Are you worried about this and our measures in place? Thank you.
Next.
Thank you. My name is Calvin from SABC News. I just wanted to ask the Minister, how long is it going to take to have or obtain vaccines? And then my second question is not related to this, but I just wanted to ask the Minister, because he is here. There was a flu wave that ripped across some provinces since April, May, June. How severe it is? Any confirmed fatalities resulting from it? The reason I'm asking this or raising this is because we received reports of 2 people who succumbed to severe flu illness in Mabopane and Rustenburg last month, respectively. Also, just before election, scores of unemployed doctors staged protests across the country. Any resolution to their plight?
Okay, thanks very much. Any other question? Questions? We still don't have questions online. Okay, let's allow Minister and members of the panel to respond to these questions. Minister will field some of the questions to the panelists. You will tell who's going to take which question, but I think it's going to start. Over to you, Minister.
Well, thank you very much for the questions. I also, as indicated, have got very educated, very learned experts here who are going to help me. In terms of the stigma issue, indeed, that's a matter which we're trying to manage very carefully, not to exacerbate. But at the same time, it is important to mention the the people at risk, so that those who are part of those key populations at risk should not also hesitate, especially when they do experience symptoms, but also try to reassure, and also for our frontline health workers also to be empathic to the users of our health services, and make sure that no one is treated with a stigmatization. But it is important to always also highlight where particular members of our community are at higher risk. Now, we know that, for instance, from as I've said, from one of the patients who was more open about, his sexuality and relationships, while others were not as open. This particular one, as I mentioned in the statement, did confirm that he has multiple partners, both male and women. So in that regard, coming to your next question, it's not very easy to actually get full disclosure and be able to get all the contacts. It's much more easier in terms of family, because family is family, and if they are living together, that's why in the statement we do mention where family contacts have already been screened. Also in terms of health workers who are caring for the patients. But when it comes to the fact that the reality of this being that it's not an infection which you can acquire simply by being in one room, unlike what we had with COVID and influenza and other aerosol spread illnesses. This one is strictly, there must have been contact between people on a skin-to-skin contact level. So that makes it quite difficult in terms of fully to be confident. But nevertheless, we are hoping that through the various media platforms through which we are trying to communicate, but also using also the other forums, as I've indicated, organizations in civil society, where people who in one way or another associate and work together. We are hoping that through those we will be able to reach more people. In terms of if we say there is no travel, I'm sure my expert colleagues here who have more experience, both from the NICD and WHO, might be able to assist us. All that it indicates, I mean, as I'm sure they are experts, they will explain better than me. But just from my own knowledge, we had outbreak in 2022. Then there was a whole year of a lull. Now, the problem here, there may be two. One is that, I think that Dr. Meyer from the NICD might explain a bit better. I'm not sure as to what extent the monkeypox virus can lie, latent for how long before it shows. That might be one, and she will tell us a little bit more. But also, the patients themselves may not have traveled, but it is not impossible that they may have been in contact with a traveler from a high infection country. So the person may not have traveled, but even if you haven't traveled yourself, we know that even with COVID, when it first broke out, there were people who had gone to other countries and come back, or they traveled. But later on, because of interaction between those who have traveled and those who never traveled. It then became endemic. So even in this case, it may be that it might have been lying latent for some time. That I'm not an expert in that, but also it may be that the patients may have had contact with travelers we have many travelers coming to the country, and all sorts of possibilities are there. I'll leave out the issue of the flu outbreak. I know the NICD does brief us, that they do the surveillance, and from time to time they update us if there are any new variants, influenza variants. I know that anecdotally, I did also ask some of the members from the department to check. I did get reports about outbreaks of flu in various schools, but as to whether there was something uncharacteristic about it, I think the experts will indicate. In terms of the vaccines, again, as I've indicated, we are working with the WHO, so this is not going to be a procurement. It's going to be donations from member countries coordinated by WHO and also Gavi. So I think in a matter of days and weeks, this should be able to materialize. I may not be able to say 2 days, 3 days, but because the negotiations are ongoing, we should be able to, and we do have the go-ahead by SAPRA to can access those vaccines. So that should be doable. I know there's a gentleman who sneaked in the issue of unemployed doctors when we are not here for that. Well, there has been a lot of progress. I think we did. I think we did issue a statement updating. There were still problems in the Eastern Cape until recently, and I did ask our Dr. Mahlati from our department and his team, the DDG for Human Resources for Health, to assist, because the problem in the Eastern Cape was not lack of funds. It was just in terms of activating the systems and making sure that the applications which were there are being processed. The provincial treasury was the most proactive of all provinces, because when there was an allocation of just over 3 billion additional from the treasury, the Eastern Cape treasury had actually directed the department to ring fence about 300 million to address the issue of the unemployed doctors. But unfortunately, there were weaknesses in the HR section of the department, and that's why I asked that our team should actually work with the Eastern Cape to assist to speed up the appointment of those doctors. But over and above that, you will always find a sprinkling of remaining problems here and there. And I can explain also, just to say, even though since the matter was highlighted early in the year, in total over 1,200 appointment of doctors was made. But because once the announcement was made that there will be funds available, even doctors who had left the public service a long time ago, some who had even gone into private practice and got frustrated, and some who might have even left the country and come back, they also now were competing for the very posts which we thought will be earmarked for those recently qualified from community service. So the uptake became much higher than the numbers which we had been given by both the South African Medical Trade Union and also South African Medical Association. So the numbers got higher because of those who were also now looking for opportunities in the public service, which is good that there is more doctors who want to, even those who had left, who want to come back, but it just puts more pressure. But as you would be aware, except for the Eastern Cape, the bigger noise which was in KZN I'm assuming that it's been resolved because there was an agreement between the doctors and the province in terms of how the posts are going to be advertised and filled up. I think it must have been done by now. We didn't have any further complaints from any of the organizations. So I want to believe that that's a matter which has been resolved. Can I ask our two experts, I don't know, Dr. Mayor, you'll come in first, just on the issues which you might want to give us more free education.
Thank you, Minister. Heidi, I'll get to your question first. I'll just add to what the Minister has commented on the issue of stigma. So the issue of stigma stems beyond the issue of the at-risk population. It's also the unfortunate naming of the disease. So you will remember that the name of the disease was actually changed from Monkeypox to Mpox. So just in the name already there's a negative connotation. But we ask you as members of the press to assist in really, drawing down stigma. It's a destructive behavior. It really affects how people seek healthcare. It affects how people respond to their health needs. And you're a very important partner in making sure that the correct information is shared so that there's no place for stigma. In terms of contact tracing, Heidi, contact tracing is absolutely dependent on the information that's shared by the patients. They do also have their right to privacy. So unfortunately, you do find situations where people might not want to disclose all of their contacts for whatever reason. And unfortunately, we need to find ways around that and try and be as thorough with contact tracing as possible. But there are restrictions. It's not only experienced in South Africa, something commonly experienced within the multi-country outbreak history so far. Corinda, I think you asked about travel histories. So as the Minister explained, Mpox is not a disease that you expect to find in the South African population. We are not an endemic country. So endemic countries are countries where you can find the natural reservoir or host of the virus. So this is a virus that actually can spill over from animals to people. It only happens in those countries that are endemic. And in the multi-country outbreak, we saw Mpox spreading beyond the endemic countries with sustained human-to-human spread. So in South Africa, we don't have zoonotic transmission. You can help to spread that message. So it's human-to-human transmission. If somebody didn't acquire the disease where Mpox is being reported in other countries, it means that they must have acquired it locally. Now, those chains of transmission can be very short. Our investigations will still tell us that, or it could be longer. We don't know yet if we had sustained transmission from 2022, when we initially diagnosed cases in South Africa, straight through to the current situation. I doubt it. I think we would have detected it. I think it's probably, and this is just my intuition as a scientist, we will see what our investigations tell us. My intuition is that there's been a more recent introduction. Could have been one person coming from a country where Mpox is being reported, and then the disease spreads in the contacts. But our investigations will still clarify that over time. Why is Mpox important? Why is it a public health issue, Corinda? We unfortunately already had a death. We need to, and it's one too many. We understand that we live in a population that, unfortunately, we have a high frequency of HIV, and we're seeing high frequency of unmanaged HIV. So people need to be encouraged again to know their status and to act on their status if they test positive. So within the South African context, where we have a high level of immunosuppression, we do need to consider Mpox and all other diseases that can affect our people as important public health issues, and hence the response that the Minister has described. Mpox versus COVID-19, Corinda, I think that was also from you. So the way that Mpox spreads is much different from COVID-19, and although we have seen a multi-country outbreak, it's far from the extent that we saw with COVID-19 or other respiratory diseases like influenza. So it's very different in the way that it transmits. It's very different in the number of people that are affected, and it should actually theoretically be more easily contained compared to something like COVID-19. So I hope that answers your question, Corinda. Calvin, I think your question was answered about the vaccines and also about the unemployed doctors. Thank you.
Anything on the flu?
Anything else from the floor?
The flu.
Flu, sorry. 1 second.
There's a question about the flu, whether there's mortality.
Oh, the current flu season. So winter season is flu season in South Africa, so we know that and we expect that. The rumors are that we are experiencing a more severe flu outbreak. To my understanding, not being a flu expert, but being a zoonotic disease expert and an Mpox expert, my understanding from the surveillance reports is that there's currently not a signal showing that it's something or a very significantly different flu season. But do please keep your eyes on the NICD website and also the communications through the Department of Health. This is continuously monitored, and we're able to quickly report if there's any changes in our findings.
Okay. Yeah, you can come back. Yeah, I'm going to allow the WHO, Dr. Fabian, to also make some inputs.
Thank you, Foster. Thank you, Honorable Minister. I will add a couple of few inputs, particularly on the treatment and also on the vaccines. Then I will also invite my colleague, a technical lead, Dr. Wamala, to add a couple of few comments on, I think, one or two questions from the audience here on the outbreak definitions on the Mpox. So in terms of treatment, as the Minister said, we are working very closely with the ministry team and also partners to make sure that as much as possible, as soon as possible, we get the drugs available to the patients. As we speak, 10 doses have been packed, just waiting shipment from Geneva to here. So we're working with the team to make sure the paperwork is actually done and this shipment can actually be available. But also more other doses to be ready and be made available as soon as they're required. On the vaccines, as you know, Mpox has been around quite some time, as the Minister said, since 2022. It was a global public health emergency, and several countries were affected. And so there are several countries with the vaccines actually made available. So we will continue to work very closely within our team, but also working with our regional office and headquarters and other expertise to make sure that these vaccines are also made available in the country as soon as possible. So with those two, let me invite Dr. Wamala to provide some response to specific questions on the surveillance, but also the case definition on the outbreak. Wamala.
Thank you, Dr. Fabian. I've been asked to comment on the definition of the outbreak, and the definition is informed by the information that we've learned since the multi-country outbreak started. And these definitions continue to be updated as new information becomes available. So currently, when we detect at least 2 confirmed Mpox cases in a country, even when they are not epidemiologically linked, that country is believed to have an outbreak. So we have thresholds. So once at least 2 cases are reported, we believe we have an outbreak. We've reported 5 cases in South Africa. All these cases have no, as the minister indicated, they have no history of international travel. So that really speaks to transmission that has probably not been picked. So even when we have 5 cases, that is already a sign that we potentially have a very big outbreak on our hands. You've also noted from the minister's update, there have been 38 contacts listed for the 3 cases in KZN, and only around 8 for the 1 case, first case confirmed in Gauteng, and the process is still on to identify the contacts for the 5th case that passed on. So that also shows you that, and many countries have experienced this. It has not been easy to identify the contacts, and even from this press briefing by the minister, you can clearly see there are constraints in actually identifying the contacts. But as the minister has indicated, it's really very important that we all remain vigilant. We should be aware of the symptoms and report promptly to the clinics for checkup. The health workers are professional. They are trained to maintain confidentiality for all the information shared. There is also an advantage in seeking care early because you can get tested early, and if you are confirmed to have Mpox, we now know that there is some treatment that can be given, especially for severe cases. This treatment actually works better if started early during the course of the illness. There's been also a question on vaccines. Yes, vaccines is one of those tools that we are really using to ensure that within the next 2 years, we eliminate Mpox. So WHO last month released a global strategy to eliminate monkeypox outbreaks or cases globally. And one of the core interventions to this strategy is the use of the Mpox vaccines. The Mpox vaccines will not be used as we did for the COVID-19 vaccines. So we'll not be doing mass vaccinations. But as the minister has indicated, we will actually do targeted vaccinations, what we call pre-exposure prophylaxis vaccination for high-risk groups. And I think these have been well identified in the context of South Africa. We continue identifying this as the epidemiology, we get a better understanding of the epidemiology of Mpox in the country. But as the minister has indicated, currently we are looking at vaccinating key populations, health workers, laboratory workers, and that criteria will be improved as more information becomes available. There was a question on how soon vaccines will be here. The minister indicated that there are bilateral discussions with countries in Western Europe that have stockpiled vaccines beyond their country needs, and those vaccines may expire if they are not used. So those bilateral engagements are ongoing with support from WHO, and if those bilateral engagements with countries in Western Europe go very well, maybe even within the next few weeks, as the minister has indicated, the vaccines will be here. There's also an option of doing bulk procurements from the manufacturers, and the lead time for vaccines being available from that channel depends on how soon funding can be made available, for example, from the Treasury to support procurement from the manufacturers. Thank you very much.
Thank you very much, Dr. Wamala, Minister, Dr. Weah, and Dr. Fabian. Let's now get the second round of questions and clarity-seeking questions. I saw one hand there.
Yes.
Okay.
Why are men who have sex with men specifically more at risk? Why are they high risk?
Okay, that's the only question. Any more question, follow-up? Okay. I think as we are about to wrap up, maybe we can come and we can also do the summary, then we finalize it. Dr. May, oh yes.
One question?
Yeah, just one question.
All right. So firstly, just to confirm why we define men having sex with men as an at-risk group for Mpox. If we look specifically at what's happening or what has been happening within the context of the multi-country outbreak, it's more than 85% of cases that have been reported in males in the age group similar to the cases that we've been reporting here in South Africa. And by far, most of these individuals actually self-disclose that they are men having sex with men. So we define men having sex with men as a risk group based on data from the multi-country outbreak. The why is a little bit difficult to explain, but I will try my best. So if we look at what's happening, for example, in a country like DRC, which is considered to be an endemic country where we've got transmission also from animals to humans, you actually see that the male to female breakdown is about half-half. So it tells you a little bit about how the virus is being transmitted. So the Mpox virus is actually not a highly transmissible virus. We already had the comparison between Mpox and COVID being much more transmissible than Mpox. So with the Monkeypox virus, so remember we talk about Mpox disease, but the virus name is still called Monkeypox virus. That's not a mistake when I call the virus the Monkeypox virus. It requires direct skin-to-skin contact. So you can imagine somebody having the lesions and a person that's not infected yet and skin-to-skin contact. Think about sexual encounters. Use your imagination a little bit. Lots of skin-to-skin contact. I don't have to explain that too much. So through sexual encounters, the Mpox or the Monkeypox virus is finding a very efficient way to transmit between people. So through some unfortunate event, an individual or individuals that are men having sex with men were infected with the virus prior to the multi-country outbreak, and through sexual transmission, men having sex with men preferring to have sex with men. Some also have sex with women, but mostly with men. You can have the chain of transmission in this population group. Does that help your understanding, or do I need to take it a bit further? Thank you.
Thank you very much. Any other questions? I'm going to allow a minister to share his parting shot before we officially adjourn this meeting briefing.
Well, thank you very much. Thanks to all the media houses present here. Let me also thank the colleagues who are with us, NICD, WHO, and also from the health department. Really, in closing, one will say that this is the disease which, in terms of its risk to the population, can be minimized. But the fact of the matter is that because, as already explained by Dr. Meyer, that we have already seen that we have had one death, and one death, it's just one death too many, of a preventable nature, because this is a disease which further infection and spread can be prevented. So we would want to encourage people, those who may have had contact with the patients who have already been diagnosed, please not to hesitate to come forward for testing, and also to say that for the fact that this is a disease which can be treated, anybody who has any suspicions in terms of how we have mentioned that how this illness presents with skin lesions, painful skin lesions, that if you have any suspicion, any doubt, rather go to the nearest health facility so that it can be tested and this disease can be excluded, so that we can save more lives. So that's really the main message which we want to go out there, that working together we can be able to break the cycle, and actually as WHO would want to eliminate. In terms of, there was a question in terms of the vaccines, the number of vaccine doses. At this stage, we're working on the broad criteria of those at high risk, and as we develop the magnitude, we're hoping that there will be no further presentations of people infected with this Mpox. But as we do the tracing, the criteria has been developed working with NICD and WHO in terms of people at risk. And of course, even when we say, for instance, that people with immune suppression, for instance, not everybody who's HIV positive is immune suppressed. People who are taking their treatment will actually be well protected. So there will be further criteria to narrow down, and as indicated, there is no suggestion that even when we do get the vaccine, there will be a mass vaccination. It will be very highly confined to those highly at risk. So it will be very limited doses. I may not be able to say the actual number at this stage, but those are the details which our team, together with the NICD and WHO, are working on. And those who are at risk, we're hoping that we will be able to acquire the first doses of the vaccination in the matter of days, as the discussions are ongoing. And those who are at high risk, including the health workers, for instance, as we know, one of the patients demised at Tembisa Hospital. Even there, it will not be all the workers at the hospital, but it will be those who would have been exposed in terms of the management of such patients, who will be priority to get those vaccine doses. So I think we can leave it there, ladies and gentlemen. Thank you very much.
Thank you very much, Minister and members of the panel, for sharing this with the public. Hopefully, we believe that they got the message. They will assist us to preach the gospel in order to curb further spread of this disease. On that note, I'm going to adjourn this media briefing until we meet again. But we'll always be available to communicate through different platforms. Thank you.
Thank you very much. Thank you. Thanks for taking all the difficult questions.
You want to? Let's do a quick.